Welcome back from the break. I'm Mabel Jong. You're watching continuing coverage from the World Healthcare Congress. This is WHCC TV. Thanks for joining us. And we're going to be talking about a health plan design. Our guest in the studio right now, Carl Schuessler, will be introducing this plan and what it took to bring the elements together. Thank you, Carl, for being in the studio today.
Thank you, babe. It's good to be back again.
Yes, and you're founder of Mitigate Partners.
Yes, ma'am.
Okay, so you have a health plan called the FairCo Health Plan Design. Tell me about that.
Sure. Mabel, this started probably 6-7 years ago. We were very frustrated with the programs that the insurance companies had, the programs that some of the independent third-party administrators had, and so we really sought out, it's been almost a 7-year journey, to find the best, what we call high-performance healthcare solutions that we could find, and that was anywhere in the world. And we have vetted and interviewed and talked to hundreds of companies that have solutions that can actually influence a plan spend and produce better outcomes for the members. So in doing that, you would meet TPAs that had a couple of ideas and a couple of solutions. We decided to bring them all together on one platform. It's about 16 solutions that work together seamlessly to try to reduce health plan spend for an employer and also produce better outcomes for the members.
Okay, so can you be specific on what it looks like?
Sure, I'll try. I can give examples of it. We recently had, probably in the last 6 months, we had 4 babies born in two different clients. And down in this part of Florida, this particular hospital that's one of the better hospitals, they charge $35,000 for a vaginal birth.
Okay, wow.
Okay, which is a little bit high.
Yeah.
We were able, through our cost and quality company that we use, that the members call into, they're required to call into, they will always go out and try to get a cash price for the procedure. And we were able to secure a cash price for those deliveries, paying 30 days in advance of the delivery for $5,000. That includes the facility and the anesthesia, which is a little over 120% of Medicare versus 8,000% of Medicare, and it eliminates any balance billing potential to the member. It really, Mabel, I think the best way to describe it is the only time in healthcare I've seen everyone's interest in 100% alignment. So you have the member who gets 50% of the savings to offset any of their costs, and we generally don't have deductibles and costs in our FairCo plan, but if there is any cost associated with that event, they get 50% of the savings, maybe up to $2,000, depends on the plan. The cost and quality company gets a fee for negotiating the cash price, so they win, so they're aggressively trying to get cash anytime a pre-certed or elective procedure comes in the door. And then thirdly, the plan sponsor, the employer, wins because they get a great price, less than they would have ever paid.
Well, how were you able to negotiate such a dramatically lower price than what was previously quoted?
Well, maybe you just have to be smart.
Okay, simple as that, huh?
All it takes is a good advisor and a little courage, and you also have to have an employer who is willing to do that. We were able to do this because of the team that we've assembled in the FairCo Health Plan and having the appropriate partners. It's not us doing all of this. We identified the partners. We're involved, actively managing the plan all the time, but it's the partners working together and being on the same page that allows that to be achieved, and that's what we were able to identify, and that's what makes it work.
Okay, how can we get more people involved working together like that? Well,
I've talked to a lot of people. I mentor a lot of benefit advisors around the country. We spoke here in Brian Klepper's session on Sunday about the FairCo Health Plan and how it works. We're speaking tomorrow, or I guess Thursday, at an ACO Direct Contract Symposium in Kansas City to talk about that with a group of employers. Because what I would say that probably the biggest thing, and I left off, it's really about employer-built healthcare, not insurer-built healthcare. And most employers are allowing what we refer to as the BUCAs, Blue Cross, United, Cigna, Aetna, Humana, to build their healthcare. So if you're IBM and let's say you use United Healthcare, you tell me that you custom built your plan, you didn't. It's Buca Insure built healthcare because they're pulling the strings, putting the solutions in. We basically unbundled the whole thing, and we call it our party. We brought our party to the TPA, and we built our plan, employer built. We did a hospital back on October the 1st. We had a 5-hour meeting. I know that would be painful for you to imagine somebody spending 5 hours with me. That's not funny. Anyway, we spent 5 hours with them building their plan. And don't have the time to go into it today, but that's what we do. Nobody does that. I mean, there are some great advisors here that you know that are doing that type of thing, but that's what you have to do, and that's employer built, and more importantly for this hospital, it's community owned healthcare, not insurer owned.
Right. And
we have to relocalize the dollars and get back to neighborhood healthcare. I call it Marcus Welby MD days. You probably don't know who that is, you're too young. But
I'm kind of sorry that I do
that's
know.
All right. I know, me too, unfortunately. But the whole point of that is getting back to relocalizing the care. Getting rid and eliminating the counterproductive barriers, the insurance companies, all the pharmacy, all the people, and bringing it back to the community and letting the community pharmacists, letting the specialists, letting the primary care doctor, and the members here, and I call it the love triangle. People say it's perverted, but it's the love triangle. It's the local care team, and today, when you have the Buca involvement, you can't do that because there are all these people telling you what to do.
Right,
so that's what we've tried to do, and then we keep the money local in the community instead of putting it in the hands of some of the cartel members. Okay,
so we're bringing in the cartel. Well, that's good stuff, Brian. That's good stuff, Carl. We talked about Brian Klepper so much, I am calling you Brian. What are there any other takeaways you want to leave with our audience today?
I think probably the one thing I would say is these employers need to wake up. We struggle getting that message across to them. If people ask, what's the hurdle? This is unbelievable what you've done. If you think it works every time we go out there, I probably wouldn't be here right now. I'd be at Health City, Cayman Islands, with Mary Jones and their team down there enjoying myself. But the challenge is getting the employers out of their own way. They are so beholden to a broker there's a big difference between a broker and an advisor. Big difference. An advisor leads. They lead the client. They don't just say, hey, you might consider this. They lead, and the clients will usually follow. So our biggest challenge is changing the employer's mind and getting that mindset changed. And you may save somebody. Sometimes the hot button is not savings. And so it's amazing with the dollars that they turn their head away from, it just turn the other way. But I think the fiduciary responsibility component that's starting to pop up is serious, and they are not being good stewards and fiduciaries of their money, and their employees are now paying a big chunk of the premiums, and it's commingled. They've got a fiduciary responsibility that needs to be addressed.
Can I ask you, how are you finding the conference this year?
This conference, and I'm not paid to say this conference to me, I'm asked to speak at a lot of conferences around the country, and even if I wasn't speaking here, this conference to me has the best content, the most depth, the most choices. I mean, if you want to, and I joke, you want to take the cartel track and go that route, you can. You want to go the route where a lot of us think and talk, you can go that route. You want to go the hospitals, whatever, there's so much, and I think that y'all do such a good job, Vidar and all the team. I mean, everyone's here great. Rena, Joseph, y'all just all do a wonderful job. So I'm a huge fan. I mean, this is the 3rd year in a row I've been, so I wouldn't miss it.
All right, see you next year, Carl.
Okay, thank you, Mabel. Thanks for your time.
Thank you, and thank you all for tuning in. Stay with us.